Hi, we're here with John today. And John, do you give Dr. Rutledge and CELS permission to use your video on the internet?
Yes, I do, ma'am.
So, John, it's been about 6 months since your surgery, is that right?
Yes.
And 6 months ago, how much did you weigh?
287 pounds.
And today, you skinny guy?
197 pounds.
Ooh, so, wow, 90
pounds in 6 months. You got it.
You look fabulous.
Well, I feel fabulous.
And your visage changed a little. You're now a rock and roll cowboy.
I'm a cowboy. I'm a, rock and roller, you know. I'm dressed up a little early for Halloween, but it feels good.
Just to let you know, he used to come in polo shirts. And
yeah, I'm going to take off my sunglasses, folks,
okay,
because then you can really see my eyes.
Hey, while you have that picture there, why don't you lift up that photo before and I'll scan in. And let me see. Lower, a little bit lower, a little bit lower. Look at that. That's before. On the left there, top left is his first picture. And I'm going to see if I can scan it. Let me see. Look at that. And if you move that right to the side of your face, we can...
What?
The picture, we can get a photo of you now. Look at that. That's amazing. You look great. Okay, let me just adjust that a little bit. Okay, so now before surgery, you were pretty sick. You were on a lot of medications.
A lot of medications. Doctors had a very poor prognosis for my future in the next year or two. It's heavy on insulin, over 300 units a day, 6 shots a day. Wasn't controlling my insulin. My blood sugar levels were 300 on the insulin. I couldn't control it. They were going to put me on an insulin pump last fall, and I had other problems. My kidneys were failing. I was down to 30% kidney function, and things were not looking real good for Johnny here. So after perusing the internet, I was fortunate enough to find Dr. Rutledge's website, and after 2 months of clinics before my operation, I was convinced. It really didn't take a lot of convincing after hearing all the testimonials from other patients that I should go forward with this. I wish I could have done it 10 years ago. Unfortunately, I wasn't aware of it. I had no complications in spite of all my medical issues. The worst pain I had was when my wife took my bandages off 2 days later. I kind of ouched. But now I've gone to see my doctors. Since then, in the last 2 weeks, my kidney function is now up to 62%, which is normal for my age. So the thought of dialysis right now is out of the question. That's just great.
Wonderful.
My diabetes is still here, but greatly reduced. I take usually 1 shot a day of about 10 or 15 units. We expect to be off insulin in the next couple of months, so we're hoping for that. And my blood sugar is, in spite of the lower, they're only running 100 to 150, which is great. So everything else seems great. My blood pressures, I take no blood pressure medication. Before I took 3, and my blood pressures are usually 105 to 110 over 60, 65. So they're normal. Everything seems to be moving along.
Well, you look good. You look very motivated. You're moving around with ease. You look a lot different than the man that walked in 6 months ago.
Exactly, exactly.
And how are you emotionally? Are you look so happy?
Oh yeah, and people tell me when I come they can't shut me up when I'm talking about the operation and how great it is. People say, well, you can tell you feel better because you're just talk, you know. I've come out of my little shell, so to speak, you know. And
that's right, you just came back from a trip, right?
Yeah, I came back from a 6-week driving tour, 7,000 miles, and the people back home, I kept my operation a secret. I'm from Michigan, and I've been out in Vegas for 10 years, and they didn't know I was going to have the operation. And so after losing this weight, we decided that we won't tell them, and we'll drive back and surprise them. And that's what prompted the cowboy outfit, was I was going to walk in as a new person. So I did, and they were surprised, and they all wished me well and thought I did a great thing by taking charge of my life and turning it around.
Wonderful. So let me ask you this: how was your experience with Dr. Rutledge?
I don't know how I can say. I can't say enough about Dr. Rutledge. I'm glad he decided to do the surgery. He didn't want to because of all my medical issues. Right. But no, he is a great guy. He's fun to be around. A lot of doctors, they're very, I don't know if stiff's the right word, but they're kind of just, everything's just, business, talk to me about business, nothing else. And Dr. Rutledge just puts you at ease, and he's just a guy I could go to lunch with or dinner with and just have a great time. I haven't, but I could do that sometime maybe.
Absolutely.
But anyhow, he's a great guy. He cares about his patients. He's got magic hands.
Is it hard to see him after surgery? Some people say he doesn't do good follow-up.
Is it hard to see him? I had open heart surgery in 1995, quadruple bypass. My surgeon, I never saw him after surgery. He wouldn't talk to me, never came into the room. So don't talk to me about surgeons who don't say, Dr. Rutledge is fantastic. I got his cell number. I can call him any time, other than I won't wake him up in the early morning hours, but I call him and he gets a little irritated if I don't call him. So this is, of all the doctors, and I've seen a lot of them in my years, Dr. Rutledge, by far, is the most approachable.
John, you look wonderful. I'm looking forward to seeing you every month.
Well, I come to clinic often, not so much now, maybe every 2 months or something like that, because I live here, so I'm able to drop in and see everybody.
It's good. We'd like to see you back.
But it's great,
Like to hear your progress.
I highly recommend it. Highly recommend it.
So go have the mini gastric bypass.
You better believe it. You better believe it. You better believe it. I mean, this is unbelievable. I mean, I've never had. I mean, I've had tooth fillings that were worse than this.
Oh, well, thank you, John.
Okay. Much.